Hi, thank you very much. And thank you very much, Fofi, for those very kind words and the introduction. And also thanks to Georgia, I think who's on this call as well, for the invitation to speak at this event. So first of all, can I just start by saying congratulations to CAN, because many other organizations have failed to have their annual meeting where you guys have managed to do it. So that's a really impressive achievement. I hope everyone enjoys what looks like an excellent program. So what I'm going to try and do over the next 30 minutes or so, or 35 minutes, is talk to you about work we've been doing in the United Kingdom, but also internationally as well, in trying to establish what we think are the research priorities for COVID-19, and not just the pandemic now, but and beyond. And I mean, various speakers have already touched upon how dramatic the impact of COVID has been. So obviously the rector and the dean and yourself, Sophie, have also introduced the real challenges that we've all been facing. But so what I've been interested in trying to do is bring a large group of people together and lead an initiative, which I'm going to talk about today, which culminated in the publication of a key position paper, which I hope you will find interesting and stimulating as a group of researchers in a broad range of neuroscience and psychological science, etc. But I suppose just a starting point is to consider what we were all doing back in the 11th of March. I was actually in the United States at the time, about to be locked in, as it transpires, whenever the World Health Organization declared that coronavirus was now a pandemic. And as we know, this was probably, well, certainly in my lifetime, probably one of the biggest moments that I can recall, because we all knew that this was going to have a huge impact on the future of how we live. But that's crucial. But that was back in March 2020, and a lot of water has passed under the bridge since then. And indeed, what's alarming to me is if we now look at the very recent statistics. So just to place some context into what we're going to talk about here today. So as we can see, the coronavirus impact across the world, we can see now there's been over 35 million cases confirmed. And of that, we've got nearly over a million deaths. So bereavement and death have been shockingly large. But if you look actually at Europe alone, we can see here that, so in the same window of time, there have been nearly 6 million cases in Europe. And of those, nearly 250,000 deaths. And again, if we look at the UK, where I'm based, we've had around just over 40,000 deaths. And interestingly, I was looking at the data for Cyprus. So Cyprus, obviously, is a small island, but yet you've had over 1,800 cases and 22 deaths. So this has obviously been a major, major challenge. And as what I suppose would like to talk about next is just really conceptualizing how COVID is such a different, unique, and hugely damaging pandemic. And indeed, what I often describe it as is that COVID is the greatest biopsychosocial emergency we've faced this century. And some might argue ever, but that's a debatable point. Well, I've got a role in the British Psychological Society, as I was alluded to, where I chair the BPS's research board. And as soon as the pandemic happened back in March, or obviously beforehand, but in March, one of the things that became clear to us is that this was an extraordinary opportunity for psychological scientists and psychologists generally, and also neuroscientists and all others, but particularly from a psychological point of view, was that we believed that psychology had an integral role to play in helping both us to understand, respond, and to recover from the COVID-19 pandemic. And indeed, so what this happened was the BPS then set up, you'll see in a second, what we call the BPS COVID-19 coordinating group. And I'm going to talk about some of the work of this group in this talk. But again, it's worth having a visit to this particular website because there's an extraordinary amount of resources, and I'm sure it's the same in Cyprus. But certainly I can only speak here but from the BPS. There's lots of different guidance produced for how we should best advise government on shielding, how we should deal with hand washing, the health behaviors, and responding to the government restrictions, etc. But what struck me was that one of the things that we didn't have any clear guidance as researchers about how do we respond and what do we believe are the major priorities. And so, as I said already, we'd set up this COVID coordinating group, which was chaired by the president of the British Psychological Society at the time, David Murphy, and co-chaired by myself as the chair of BPS Research Board. And what we wanted to do was to facilitate and oversee the vast amount of work that colleagues were doing with regards to COVID-19. And it's probably exactly the same in Cyprus as it was elsewhere in the world, and certainly in the United Kingdom, where at that time there were huge numbers of people, who basically felt that we really needed to do something to try and help with the pandemic. And indeed, what we started doing was working in different areas. So we were looking at how we can, initially we set up the behavioral science and disease prevention work stream. And again, we've produced lots of excellent guidance, which has then directly fed into government committees such as the SAGE group, which is the Scientific Advisory Group on Emergencies, another group called SPI-B, which is the Behavioral Science subgroup, which again advises governments on strategies. But also there's lots of other areas, things like bereavement and confinement. And we're all dealing with these different concerns. We're having to learn to work differently, etc. But alongside that, I was interested, as I say, in the idea of trying to establish what the main research priorities were. And one of the major triggers for that was that there was a publication in Lancet Psychiatry, which was doing something similar, but for mental health science. And my view was that psychological science and psychology more generally has more to offer than just talking about mental health. Of course, that's hugely important. But what I wanted us to do was to consider all areas of psychological science, which it speaks to a lot of the areas which are covered by CAN. And so, so that's where we were starting. And what I want to talk about is exactly the work we've been doing in that regard. So, maybe just worth considering why we also believe that psychological science has an integral role to play in both the response to the pandemic, but also in how we recover. And I think it's because human behavior is at the center of COVID-19 and this entire pandemic. So, I should say as well, I don't know what it's like in Cyprus, but certainly in the United Kingdom, we are right now in the cusp of a second major wave of COVID. The number of the statistics have gone through the roof, and it's really alarming. And we're going to hear another major announcement by the Prime Minister on Monday. And it's likely we're going to go into maybe not the full lockdown again, but something very similar. But let's think of the context then. So as psychological scientists and neuroscientists more generally. So to my view is it's the collective and individual responses to COVID-19 and the countermeasures have fundamentally changed how societies function, how we work, how we educate, how we parent, socialize, shop, communicate, and travel. And it has dramatically changed everything that we do. So the argument here is that I would suggest is that the effect of the pandemic, the effects already been shown to be profound, but they're likely to shape human behavior right now, but well into the future. And indeed, so it's not just mental health is serious, and we've been doing a lot of work in that regard, but one of the major drivers behind our research priorities work was to recognize the breadth of contribution that we could make. The other thing that makes the pandemic unique is there's large numbers of people who are infected who remain asymptomatic. As I say, we got these global impact of restrictions on how we live, and that happens in virtually every country at different levels. Where, as I say, we've got the likelihood of second or third waves. That's certainly what's happening in the United Kingdom and certainly elsewhere in Europe. But what's also different is the global reach of this pandemic. It impacts on both high income and low income countries. And also it's the virulence of this particular virus which makes it pretty alarming. But the other thing I think it's important is the impact of COVID isn't just on biological outcomes. It isn't just on the number of deaths. It's also got the economic, health, psychological, and social consequences. And that's what we as scientists need to be embracing more, not just now, but also in the future. So as I said, what we did was, because my view and this group's view was that psychological science has an integral role to play, what we wanted to do was to really try and understand what are the major priorities we should be directing our attention at in the shorter and longer term. So, and indeed, and also to think carefully about how we are so well placed as psychological scientists with our methods, approaches, and interventions to help with the recovery. So this particular group that you'll see about in a second in the paper had three broad aims, which to frame the breadth and scope of the potential contribution from the discipline for the whole psychological science discipline, to help assist psychological scientists focusing on their resources and where the gaps were, and also to help funders make more informed decisions. So they were the three main aims. So what we did was, and it was a pretty crazy time, this is way back in April that we decided to do this, or even maybe actually the very end of March. And so we initially convened an expert panel of colleagues around the United Kingdom initially, representing each of the key areas of our discipline. For example, cognitive psychology, biological psychology, developmental, etc., health. And we used the various established procedures, which I won't go into detail about today, but you can, if you want, I hope, read the paper afterwards. But we initially met as this group, and we'd meet, and we had these very intense meetings over a period of 4 weeks. And we also had a broader advisory panel, and we also had international input. But alongside that, so ultimately this was an expert group-led initiative. But we also surveyed a large sample of psychological scientists in early May, as well, as alluded to here on the right-hand side. And then this is the group. Welcome to the group. So this was chaired by myself and my colleague Chris Armitage at the University of Manchester. But again, we wanted a range of colleagues across the United Kingdom and across the different areas of psychological science. And then we also, as I say, we had a broader group of colleagues, another 16 or so. So this is getting into a big piece of work of colleagues who, again, we would meet, and they would also give us feedback on our different priorities as they developed. And of course, this is what we all understand as life now, which is dashing from one Zoom meeting to another, or a Teams meeting. But this is the group where we were trying to tease out what we felt were the key priorities. We also had international advisors. We invited Dan Schachner from Harvard and Susan Fisk from Princeton to also feed in and give us additional background information. So they were our key advisors. So what did we do? So very briefly, so the first thing was the survey. And the survey of psychological scientists was done in order to see, in case we'd missed any key issues, but also we wanted to get a feel across the discipline in each sub-area what psychological scientists felt were the key priorities. What was the top priority, for example? And this was just used to inform our thinking on our 7 priority domains that you'll see in a second. So this is just to give you an idea. So here's the different disciplines within psychology, broadly speaking. But what we were able to establish was, we were able to establish within each area of the discipline what people felt was the most important thing we should be looking at. So for example, in the biological group, and these are just alphabetical, how do we address the negative biological impacts of COVID-19 virus on mental health? We had thought ones, for example, to do with cognitive. What were the impacts of COVID-19 infection, treatment, recovery on cognition, behavior, and the brain? So what we were able to find was really, it helped us inform the expert group's thinking. It was really reassuring. There was lots of overlap, as you'll see in a second. But what we also did, not included in the paper, but we also then analyzed qualitatively what these 500 odd psychological scientists felt were the key priorities. And again, you can read about these findings in a report at this link here. But that, again, was just informing our thinking. But what was particularly alarming and interesting in equal measure to me was what was the key message that came through virtually all of the qualitative feedback and all of the informal feedback we had was inequalities. So what was interesting to us, and it's still exactly the case now, and this is really where we should be focusing our attention. So what was central to virtually all of people's responses was the idea that there were clear inequalities in how the virus was impacting. So this is the notion that COVID-19 is not a single pandemic. And what we should be doing, we should be conceptualizing it as multiple parallel pandemics. So the idea that it disproportionately impacts on different groups. So also scientists should be considering this. And the key areas were things like ethnicity, socioeconomic status, etc. And what we know, we all know in this meeting today, is that certainly around the world, that Black, Asian, and minority ethnic groups are disproportionately disadvantaged. We also know, similarly, socioeconomic status plays a role, long-term health conditions, exclusion, groups that are already excluded. So what the key point to take home here is that what we really need to be doing, anyone who is doing any work on COVID should absolutely be exploring the role of inequalities. And that to me is so fundamental. And the notion of intersectionality, this is the idea that it's highly likely that many of these groups interact. So for example, a BAME individual who is from a low socioeconomic group who might be male might be at greater risk. And certainly a lot of the neuroscience really needs to turn its attention to that next. But so all the work that we were doing was all about trying to decide what we felt were the key research priorities. And what we came up with was 7 simple, broad categories where we felt that COVID-19 was having an impact, and we as psychological scientists and you as neuroscientists should be directing your attention. And these are summarized in this slide here. So what I alluded to at the beginning was we know it's very clear that COVID-19 is impacting on mental health. And indeed, we've been publishing some work on that recently, and many others have as well. And that is not in any way to undermine the significance of mental health and mental illness in this context. But what our research priority work showed was there's many other aspects. And what's relevant here today is the impact of COVID on physical health, how it interacts with both physical but also with chronic conditions. How does it impact on the brain? And indeed, interestingly, I was reading our paper earlier today, and in fact, I tweeted about it just before this talk. And what we argue in that particular paper, there's lots of really important brain work that needs to be done there. So to understand exactly the long-term implications of COVID on brain functioning. And what's interesting to me is that what we allude to in that paper back in May is the notion of long COVID. And I think that remains a hugely important area indeed. But the other thing is, look at all the other aspects. We need to understand groups more. And certainly in the United Kingdom, where I am based, this has been a huge issue. And this is about how we understand groups, the social psychology of the pandemic. That's what we need to be doing. We need to be understanding trust issues. We have to understand conspiracy theory works. We also have to understand what are the major factors that predict uptake of and adherence to government restrictions. And then we look at the impact on education. It's, I'm sure, the same in Cyprus, but certainly elsewhere in Europe, the impact on education has been dramatic through lockdown. And even the impact now of schools and universities, we're all grappling with this, but we really need to understand that. And also the impact on children and families. Child development will be significantly impacted. And what we need to do as psychological scientists and neuroscientists is really understand those developmental effects over time. How do families function? And the other thing that we've all been doing is working differently. And our working arrangements are completely, have been thrown up in the air. So we have to understand, how does remote working impact on various different aspects of productivity in an organization, well-being in an organization. So for example, I haven't been in my own workplace, my own office for nearly, well, since February. And it's unlikely that I'm going to return until early next year. So it's, you know, these are really incredible questions and things that we really need to understand what's happening here. And then the final one I note is behavior change and adherence. And this is classic health psychology. It's trying to understand what factors predict and maintain behavior change, because ultimately behavior, as I alluded to at the beginning, is it's the center of this pandemic. And we as psychological scientists and neuroscientists are in the game of trying to understand behavior. So we really need to come into our own there. I'm not going to go into detail, but in the paper, what we'll be able to see, we've unpackaged each of these different research priorities. So I would be urging colleagues in this conference to look at this particular paper and go, well, and read the background and where we think the gaps are. So things like, you know, how does collective identification, impact, and social responsibility. Here's the working arrangement issues. But for this group, there's going to be real role for your understanding on how does the pandemic affect child development, family functioning. But similarly, if we look at the brain, there is also, if we look here, physical health in the brain. So does COVID-19 have neurological effects in the brain with consequences for mental health? What are the psychobiological impacts of COVID-19 on physical and mental health? We don't know this yet. We've got some clues, but really as scientists, we should be going, right, we are right at the center of the storm, and we should be using all of our skills and tools, which I'll talk about in a second, to adapt and really run after the scientific understanding. So again, you can read about these in details because we've unpackaged them in the particular paper. But what I also want to talk briefly about is the notion that we, as I'm going to talk specifically as psychological scientists, but it's the same as neuroscience as well in many cases, but we have got an extraordinary toolbox that we can use to help answer and understand and ultimately help societies recover from COVID-19. So we as scientists have got this real extraordinary expertise in online research methods. We also we've been developing remote interventions. So the idea that our psychological interventions are now, in our paper we talk about this notion of being webside instead of bedside. So this idea that we will use what we've learned to help people recover. But we've also got skills and qualitative methods. And this is really because we're all grappling with how do we continue doing our science when well, certainly in the United Kingdom and elsewhere in Europe, you've got a hybrid conference, which suggests that maybe you're further along than we are. But how do we then try and answer some of these questions? Again, we've got skills and qualitative methods, implementation science. And the one thing that psychologists and neuroscientists are doing a lot of during the pandemic is been providing expertise at pace, these rapid reviews. We've got these amazing skills to help governments inform their strategies. And that is what we should be doing more of. But ultimately, what I want to draw brief attention to is also this final part of this slide. Because one of the things that certainly has concerned me as someone who has been an advocate on trying to promote open science and reproducibility and replication is this ensuring that we maintain open science practices and high ethical standards. And as I say here, high quality, rigorous research. And there's a couple of ways we can do that. And before I talk about that, I just want to also note whatever we're doing, what we should have at the center of our COVID-19 related scientific research is patient and public involvement. So we know that that really is crucial to better science and better acceptability of that science and better dissemination of those results. But if I want to just slightly unpackage this idea of the open science approaches, just specifically in the context of COVID. Because what we know is that as a result of the pandemic, and I'm sure it's exactly the same with many people in at this conference today, is that as soon as the pandemic happened, we all felt a bit lost. We're going, well, what can we do to try and help? And one of the things that many people did was they quickly designed new studies and tried to start testing new hypotheses. And that's fantastic, but we need to maintain good, high quality, rigorous scientific research. And one of the things that we should do is try and, if possible, use approaches like registered reports. So many of you will be familiar, but registered reports is this new format of publication where you have peer review before the results are known. So this is the idea that you develop an idea, you design a study, and then you send that off for peer review before you even collect the data. And I'm not going into detail, but I mean, there's opportunities now for scientists to use this approach. I recognize it was much more difficult earlier in the pandemic, but it's certainly something that we can think about now. And then once you collect your data, you then write it up and you complete the study, and then that's reviewed again, but your results will be published irrespective of the outcome. But I recognize registered reports is a lot of the future, but it's still something we can do. But there is an easier way, and I think it's so relevant to colleagues on this call or on this conference today, which is the idea of using pre-registration. So one of the things that we really want to do is to make sure the science is robust and that we are trying to reduce the questionable research practices that many of us over the years have accidentally been doing, and that's a whole different talk. The pre-registration is where you will in advance confirm and be explicit about what your hypothesis is or are, your hypotheses. So your hypothesis testing versus exploratory. And I just want to point you just briefly to a well-known tool. So one of the easy, quick ways of doing this is using what's called as predicted. And I don't know how many people here will have heard of as predicted, but it doesn't pretty much, it doesn't really matter where you are within reason in the research process. But say you've collected your data from your excellent COVID studies. Well, I would strongly suggest, and this is exactly what we've done in many of the different groups that I've been involved in doing research during COVID, is then look at this website or go to the Open Science Framework. And this is an easy way where you can register your scientific research questions in advance. And all it requires, as you can see here, is basically the answer to 9 simple questions. And these 9 simple questions will then form the basis of your pre-registration. And as a result, you'll be able to use immediately a URL will become live when you agree as a research team. But ultimately, you can then, in advance, be very transparent about your findings. But crucially, even if you find, then if you want to do exploratory analyses, that's absolutely fine as well. And you can do that afterward as long as you're explicit in your papers. So I'm just flagging this because I just think it's so important that we've made such leaps and bounds in the area of open science that we continue that. And we need the very best research when it comes to COVID for obvious reasons. And this is just alluding to this idea of the need for more open data as well. So one of the things that the challenge that we all have at the moment, we are all grappling with how do we work now in terms of COVID-19. So my university, my own lab, my laboratory for stress research, the STAR lab, it Leeds, has been closed since February. So we are unable to do testing face-to-face currently. So what we're arguing is that there's ways where we can all share data sets, work more collaboratively. And indeed, with Georgia, who's one of your colleagues here, and I, earlier in the pandemic, we put together a European-wide statement where we were arguing that people should be collaborating more, sharing data, and thinking about the different techniques and testing tools that we have available, things like Inquisit, and other tools which we can share with colleagues across Europe. But ultimately, the center of this is having open data. And the notion of this is a recent statement that we've just published at BPS, which is this idea that data should be as open as possible, as closed as necessary. And again, that's a really useful mantra to keep in your mind. So I'm now getting towards the end. So I want to just finish with what the call of action is, or the old call to action. So what we've argued in this paper is that we've identified what we believe are 7 key research priority domains. And we believe that when the research in this area and answers to many of these questions will help societies globally recover from the pandemic. And this is hugely important. So I would argue and suggest, please colleagues, have a look at this particular paper, and I'll show you a link to it in a second, and it's free and it's open access. But the other thing which we should underestimate at our peril is the role of inequalities. And actually, chances are most of us at this conference may not have been impacted by COVID. And indeed, I consider myself incredibly lucky. We've all still got jobs. Certainly in the United Kingdom, come Christmas, there is going to be hundreds of thousands of people losing their jobs. And the reason is because we get the furlough scheme, which is going to stop. There's no jobs for these individuals. It's real impact. These will disproportionately impact on groups who are most vulnerable. And that's the concern. And we as scientists have a responsibility, in my mind, to understand further how these inequalities are impacting on individuals in that regard, who are the most vulnerable, and what we can do to help. The other thing, as I say, when I was reading back over our paper which we wrote back in May, was what we also made a brief introduction into this notion of long COVID. We didn't call it long COVID in the paper because we didn't have the term. Long COVID seems to be a group of individuals who are either, having these long-term impact of COVID. And certainly as neuroscientists in this particular conference, you are really well placed to fully understand and to characterize what long COVID might be. But the other thing that we really need to think more about is also this larger scale working, which I alluded to earlier, and this need for a coordinated data collection approaches, working in research consortia. So the idea that we, I think in the future, given that resources are going to be more limited, and the pandemic is going to be with us for quite some time yet, is that we need to think carefully and strategically. It's not just one lab working on one research question. We should be reaching out to colleagues internationally as well as nationally to help answer some of these really important questions in terms of COVID. And then the penultimate point is we need to develop and innovate further. So there's some extraordinary innovations already we've seen in terms of delivering psychological interventions online. But there's also lots of scope for clever innovations in how we can test some of our key hypotheses remotely. How is it that we can, certainly I'm a psychobiologist as well, so how can we still try and do, measure cortisol remotely? Okay, and there's ways we can do that. But we need to think carefully and innovate, but share that innovation. That's the key thing. And then the other thing, I suppose, to finish on is this major drive that we must maintain high quality, open, and rigorous scientific research. So do our best to share our data, collaborate with colleagues, but make sure, if you can, try to pre-register at least your research questions in advance, because that will focus your thinking, and it will also ensure that we are reducing some of those question research practices that we've all been engaging in previously in our careers. But then, final thing I want to end with, you'll be pleased to hear, and I think I'm pretty much on time, is just pointing you to the paper. So if you just even download Research Priorities or follow the link here, this is a freely available paper. Please download it, read it. I hope you'll enjoy it. And it deals with summarizes everything that I've been saying today and much, much more. It was written by this esteemed group of colleagues here. So all I can say is thank you very much for your time. And I will now, I think, finish there. Thank you very much indeed. And I'm happy to take any questions.
Thank you, Daryl. Okay, many advisors worry about career development of junior scientists through difficulties in progression with their research, publications, participation to conferences, similar to the idea of multiple pandemics. Did you consider the inequalities of the effects of the pandemic on researchers of different status, career progression, access to resources? Can you comment on this issue and let us know something relevant that came out from your studies?
Absolutely. I mean, that's such a good question. And indeed, it is something that we discussed at length. Can you hear me okay, Fofi? Yeah?
Yes, we can hear you.
Great.
Just fine.
And no, it's a very serious issue. And indeed, in our broader advisory group, we had a range of from early career researchers as well as more established colleagues. And indeed, it's a serious issue. And one of the things, this is why the call to action is also about working collaboratively. And that means that, and it's about opening up your data, it's about sharing your data, and it's also about being more responsive to the needs of early career researchers. So absolutely, and I think if we all work together and we collaborate, which is really at the heart of this paper, if you even look at both the conclusion but also the abstract, we finish by saying there's a call for us to do that. And again, I think early career researchers, don't worry. I'm reassuring people, don't worry, because we can all work together in order to support each other. And that's one of the one of the interesting things from the pandemic is, which we didn't talk about, is there were many positives, right? So there has been this amazing sense of community resilience and community action, but you've seen a lot of that also collaboratively in terms of COVID research. So my feeling is, if you're concerned, then reach out to colleagues. But I think more senior researchers should be making sure that you think of ways how you can make data available. And also, there's lots of data we all have at this moment in time, and it doesn't have to be COVID-related work. So the idea that what you're going to notice, I suspect, over the coming years even, will be that we will find people sharing data sets in a way that, data which hadn't been analyzed or written up yet, that will happen more. So yes, hugely important issue. We all have a responsibility to ensure that we support our early career researchers going forward.
Okay.
Hope that answers the question.
Thank you. There's another question from your colleague, Georgia.
Hi, Georgia.
And she says hi. She asks, can you give us an example regarding behavior change strategies that were implemented in the UK with the contribution of psychological scientists?
That's a great question, Georgia. I mean, well, actually, we could argue, I could answer that in two different ways. One is we can give you lots of examples where we give clear scientific advice and it was ignored later on in the pandemic when it became political as opposed to being truly scientifically led. But actually, there are a number. I'll give you a really good example, actually. Early in the pandemic, a lot of social and health psychologists, colleagues of mine, were given direct advice to SAGE, the government's advisory group, which was how you communicate the messages. And even the very first message, and it's about emphasizing the we and the collective responsibility. And actually, if you look at, and you carefully look at all the early messages in the United Kingdom, it was all about, we are all in this together. And it's about every single person has a role to play. And that was hugely impactful. So actually, if you look at the statistics, you know, it may have been the same in Cyprus, I think was maybe slightly different, but certainly in the United Kingdom, where it was a full-on lockdown and major number of deaths, but the adherence levels were really high. But then you may or may not be aware, but there was a minor, well, I'd say pretty big scandal where one of the Prime Minister's leading advisors was discovered to have broken the rules. And then allegedly, I'm just saying allegedly covering myself, many people believe he lied about it, and it was a major scandal, which meant that all the trust that the general public had in the government's advice was broken. And there's, in fact, a paper just published last week, and it's called the Cummings effect. And it was the idea that whenever these basic psychological principles of trust broke down, as did people's adherence to the rules. So, but the other thing is more broadly that there's this very well-known model called the COM-B, which is which is put forward by Susan Mickey and colleagues who, again, have been advising government. And this is about capability, opportunity, and motivation. And again, that has been informing a lot of the government's responses. And indeed, the group that I was involved in, the behavioral science group, we wrote a very clear document. And again, for those who are interested, and again, this went to government and the government read it and adhered to it. We wrote this document on the behavioral science principles which should underpin the pandemic. And again, that's been very influential. And then the final thing, the paper that I'm talking about today has also went to the government as well, and to the Department of Health and Public Health England. And again, they, I hope, have been acting on it as well. So hopefully that gives you, Georgia, some flavor. But I think it's the good and the bad. Early on, they listened to the scientists. Later on, they've stopped doing that.
Daryl, the other issue that has come up through research and also service delivery is the fact that COVID has created additional disparities in patient care and in research access. And that's something that we're looking, we have a special task force at the American Congress of Rehabilitation Medicine looking at the effects of COVID-19 across the board in terms of service delivery issues, but then also practical issues in terms of providing services to those who might be infected or to patients who require services but cannot access through long distance or remote types of methodologies. So I don't know if you have any comments on that.
No, I mean, that sounds really interesting and important work that you guys are doing, and also in the American Society in that context. To me, what that also speaks to is the digital divide. And that's another thing that we've talked about in our paper, but also it's out there anyway. And that the digital divide has a huge ramifications. It isn't just whether or not you can have a Zoom call. It is about how you treat patients. And it's also about the fact that many patients who are most vulnerable are also the ones where it's confounded with socioeconomic status, where they don't have access to those same resources. So I actually think, to my mind, this, you know, the most fundamental thing and the most upsetting thing to me personally is the fact that there's lots of groups out there, and you're alluding to some of them, those who are most vulnerable in patient groups and rehabilitation groups, and they're the ones who are least likely to be easily get the access to the healthcare or the support. And we really need to look at the digital divide more broadly, generally on how we support colleagues and patients. But, you know, we've got time, and my view is also is that we've got the pandemic is going to be here for a while. I mean, I'm optimistic that early next year we will have, well, late this year, we should hopefully have a vaccine, and based on the Oxford study at least that I've been reading about, and hopefully early next year. But it's how we respond to the needs of the most vulnerable, I think, is what we should all be aiming our attention at.
Okay. And I think this is our final question. It's from my colleague, Timothy. Actually, he's sitting next to me. He says, "Dear Daryl, thanks for the detailed account of the challenges that come with the COVID-19 pandemic for psychological science. My question is, how could we overcome the challenges of an online research project when we accept a priori that those in need won't necessarily be able to participate in the project under the current circumstances?"
I mean, that's such a brilliant question. It's getting to the same sort of issue, because that's the complete travesty that we have to deal with and understand. Because you're right, the people who are most at need are the ones who are most difficult to access. But also, this is where PPI can come in, the idea of patient and public involvement. So I would urge colleagues in that context is that we need to think carefully, try and get access to those groups and ask them how best it is that we can help them to help us with our research. So that's a really crucial issue. The other thing is there's a key role here for finance and supporting people. So the idea of making it easier for people those groups to be part of our research. And that might be financial as well as technical, in terms of the idea of making it easier, go to them if you can. But I think that question is brilliant, because it absolutely gets to everything that I'm arguing today. We need to do everything we possibly can to get to those individuals. You know, those people with long COVID, for example, might also be the groups who are most vulnerable as well. We don't know that yet. But yeah, completely agree. Great question. And I look forward to hearing some of your answers about it, guys.
Would you say also, though, that we are in a better position now because we can anticipate the need for maybe online or digital types of needs, whereas back in March we were sort of in an emergency mode, whereas now we can plan and develop systems to address these issues?
100%. Yeah, I couldn't agree more. I mean, even though we're about to go into, you know, I think it's very likely we're now in the second wave and there might be some sort of lockdown, it won't be the same, in the sense that you're right, we have learned so much. I mean, the learning curve all of us have been on in the last 6 months is extraordinary. And even the fact, even if I use this paper as an example, I've never written a paper within 6-7 weeks where you're intensely meeting with people constantly. But the point was, we all responded to the emergency. But you're right, there's a lot of time now we've been able to reflect. Even we all have to think about even teaching, as many of us are academics. The way that we now learn, how we all know how to use Zoom or know how to use Teams, how we can run certain experiments online. So yes, I feel less concerned about how, I think we're in a much better place to respond to the ongoing needs of the pandemic, for sure. But we've still a lot more to learn, absolutely.
Okay. Well, thank you so much, Daryl. It's been a pleasure to meet you through the remote access, and thank you for your contributions. And hopefully we'll have a chance to meet in person soon.
Absolutely. Well, thank you very much, guys, and thanks for the invitation. And I hope you have a fantastic rest of day. It looks like a great program.
Thank you.